There are certain medications that millions of people over the age of 60 take every single day, believing they are protecting their health and helping themselves live longer. These medicines are trusted, widely prescribed, and often considered part of a normal routine for managing blood pressure, cholesterol, pain, or digestion. But when researchers began looking more closely at how some of these medications affect the aging body, a more complicated picture started to emerge. In certain situations, medicines that seem completely routine may also create unexpected risks when they are used for many years or when several of them are taken together. What concerns many doctors today is not simply the medications themselves. The real concern is how often these drugs continue to be taken for long periods of time without being reviewed, especially in older adults who may already be managing multiple health conditions. My name is Dr. Michael Harris. I have worked as a cardiologist for more than 25 years, treating patients with heart disease and helping people understand how to protect their cardiovascular health as they grow older. During my career, I have seen medications save lives, prevent serious complications, and give patients many more healthy years with their families. But I have also seen situations that made me stop and ask difficult questions. One patient in particular changed the way I think about medications in older adults. His name was Robert Thompson. Robert was 66 years old. He lived a quiet life with his wife and had always tried to take care of his health. He did not smoke. He rarely drank alcohol. Most importantly, he followed every medical instruction carefully and took all the medications that had been prescribed to manage his health conditions. One Tuesday morning, he woke up, took his usual pills with a glass of water, and walked into the kitchen to prepare coffee. According to his wife, everything seemed perfectly normal. They were talking about their plans for the day, when suddenly Robert stopped mid-sentence and collapsed. There was no warning, no dramatic chest pain, just a sudden collapse that no one expected. Later, when I reviewed Robert's medical records, something immediately caught my attention. Robert was taking several different medications every single day. Each one had been prescribed for a specific medical reason, and individually they were considered common treatments. But together, they created something doctors are seeing more and more often in older patients: a complex mix of medications that the body must process every day. This situation is known as polypharmacy, and it is one of the reasons I believe older adults should better understand some of the medicines they take regularly. So today I want to walk you through several common medications that people over 60 should understand more clearly and explain why reviewing them with your doctor could make an important difference for your long-term health. The first type of medication I want to talk about might surprise many people because it is not even a heart medicine. In fact, it is something millions of people take for stomach problems. I am referring to medications known as proton pump inhibitors, often called PPAs. These include drugs such as omeprazole and pantoprazole, which are commonly prescribed for acid reflux, heartburn, and stomach irritation. Many patients begin taking them after experiencing discomfort from spicy food stress or other digestive issues, and the medicine often works very well at first. The problem begins when these medications continue to be taken for months or even years without a careful review. You see, stomach acid plays an important role in helping the body absorb certain essential nutrients. When acid production is suppressed for long periods of time, it can affect how well the body absorbs minerals like magnesium, as well as important vitamins such as vitamin B12. In some older adults, low magnesium levels can contribute to symptoms like muscle cramps, fatigue, or irregular heart rhythms. These symptoms are often blamed on aging, when in reality they may be connected to long-term medication use. Now, this does not mean that PPIs are dangerous or that everyone should stop them. In many cases, they are very useful medicines. But in my practice, I often advise patients to review how long they have been taking them. Sometimes simple changes, such as adjusting diet, reducing late-night meals, or managing stress, can reduce reflux symptoms and allow the medication dose to be lowered. And that brings me to the next group of medications, which are even more common in older adults. Pain relievers. Medications such as ibuprofen, diclofenac, and naproxen belong to a group called non-steroidal anti-inflammatory drugs, or NSAIDs. Many people take them for arthritis, back pain, or joint stiffness. For short-term relief, they can be very effective. However, when these medicines are taken frequently over long periods, they can have effects beyond pain relief. In some individuals, they may contribute to fluid retention and increases in blood pressure. For someone who already has heart disease or hypertension, this added strain on the cardiovascular system can become significant. Patients sometimes notice swelling in the ankles, mild shortness of breath, or rising blood pressure readings without realizing that daily pain medication might be part of the reason. Whenever possible, I encourage patients to discuss safer long-term pain management strategies with their doctors. Physical therapy, gentle exercise, weight management, and anti-inflammatory dietary habits can sometimes reduce the need for frequent NSAID use. And the next medication on our list is one that many heart patients recognize immediately because it directly affects how the heart itself responds to stress and activity. The next medication on our list is one that many heart patients recognize immediately because it directly affects how the heart responds to physical and emotional stress. These medications are known as beta blockers. Common examples include metoprolol and atenolol. Doctors often prescribe them to help control high blood pressure, reduce the heart's workload, and manage certain heart rhythm problems. For many patients, beta blockers play an important and valuable role in treatment. They can help protect the heart after a cardiac event and keep blood pressure under control. But like many medications, their effects can feel different in older adults whose bodies process medicines more slowly. One of the ways beta blockers work is by slowing down the heart rate and reducing the strength of the heart's response to stress hormones like adrenaline. In some people, this can lead to symptoms such as fatigue, dizziness, or a feeling of reduced energy during everyday activities. I have had patients tell me that they suddenly feel tired climbing stairs that never used to bother them. Others notice that when they stand up quickly, they feel lightheaded for a moment. These experiences do not necessarily mean the medication is wrong for them, but they can be important signals that the dose or treatment plan may need to be reviewed. In my practice, I often encourage patients taking beta blockers to monitor how they feel during normal daily activities and to discuss any changes in energy levels or dizziness with their doctor. Sometimes adjusting the dosage or reviewing other medications can make a significant difference. Now, the next medication on our list is one of the most widely known heart-related treatments in the world: statins. Medications such as atorvastatin and rosuvastatin are prescribed to help reduce cholesterol levels and lower the risk of cardiovascular disease. For many patients with a history of heart attack or stroke risk, statins can play an important preventive role. However, some people experience side effects that they may not immediately connect to the medication. A number of patients report muscle discomfort, stiffness, or unusual fatigue after starting statin therapy. Because these symptoms can also occur with aging or other conditions, they are sometimes overlooked or dismissed. When patients mention persistent muscle pain or weakness, I usually recommend discussing it with their physician, and considering routine blood tests to evaluate muscle enzymes and overall tolerance to the medication. In many cases, the solution may be as simple as adjusting the dose, switching to a different statin, or reviewing the overall treatment strategy. But cholesterol medications are not the only drugs that can influence the body's balance in older adults. The next category involves medications that affect fluid levels in the body, and they are extremely common in people managing blood pressure or heart conditions. The next group of medications is extremely common among older adults who are managing high blood pressure or certain heart conditions. These medicines are called diuretics, often referred to as water pills. Examples include medications such as hydrochlorothiazide and furosemide. Doctors prescribe them to help the body remove excess fluid, which can reduce blood pressure and ease the workload on the heart. For many patients, diuretics are very effective and play an important role in controlling symptoms like swelling in the legs or fluid buildup in the body. However, because these medications increase the amount of fluid the body releases through urine, they can also affect the balance of important minerals known as electrolytes. These include potassium, sodium, and magnesium, all of which are essential for normal muscle and heart function. When electrolyte levels become too low, some people may begin to experience symptoms such as muscle cramps, unusual fatigue, weakness, or irregular heartbeats. Older adults are especially sensitive to these changes because the body's ability to regulate fluid and mineral balance becomes less efficient with age. This is why patients taking diuretics are often advised to have periodic blood tests. Monitoring electrolyte levels allows doctors to adjust medication doses or recommend dietary changes if necessary. Sometimes, something as simple as ensuring adequate hydration or adjusting potassium intake can help maintain a healthier balance. Now, the next medication category is one that many patients hear about when they are diagnosed with conditions like atrial fibrillation or when doctors want to reduce the risk of blood clots. These medications are commonly known as blood thinners. Examples include drugs such as warfarin, rivaroxaban, and apixaban. Their purpose is to reduce the likelihood of dangerous blood clots forming in the body, which can otherwise lead to serious complications such as stroke. For patients who truly need them, blood thinners can be life-saving medications. However, because these drugs work by reducing the blood's ability to clot, they also increase the risk of bleeding. This means that even relatively small injuries can sometimes result in more prolonged bleeding than expected. Some patients may notice easy bruising, occasional nosebleeds, or bleeding from the gums while brushing their teeth. These signs do not necessarily mean something is seriously wrong, but they are signals that the medication should be monitored carefully. Regular checkups, blood tests, when appropriate, and open communication with a doctor are essential for anyone taking blood thinners. With proper supervision, these medications can be used safely while still providing the protection they are designed to offer. But there is one more category of medication that many older adults use regularly, and surprisingly, it is not prescribed for the heart or for blood pressure at all. The final category of medication I want to discuss often surprises people because it is not usually associated with heart health at all. These are sleeping medications. Many older adults struggle with sleep as they age. Changes in routine stress, medical conditions, or even normal aging can make it harder to fall asleep or stay asleep through the night. As a result, some people turn to medications such as benzodiazepines or other prescription sleep aids to help them rest. At first, these medicines can seem very helpful. They may allow someone who has been lying awake for hours to finally get a full night of sleep. But when sleeping medications are used frequently over long periods of time, they can sometimes create new challenges, especially for older adults. One common concern is that these medications can affect balance and coordination. People may feel groggy or slightly unsteady when they wake up during the night or early in the morning. In older adults, even a small loss of balance can increase the risk of falls. And as many doctors know, falls can lead to serious injuries, especially when combined with other medications that affect blood pressure or blood clotting. In addition, some sleep medications may contribute to feelings of daytime drowsiness or mental fog, which can make normal activities more difficult. For patients struggling with sleep, I often recommend first exploring non-medication approaches whenever possible. Improving sleep habits, reducing caffeine in the evening, maintaining a consistent sleep schedule, and incorporating light physical activity during the day can often improve sleep quality naturally. In some cases, relaxation techniques or simple adjustments to bedtime routines can make a meaningful difference. Of course, there are situations where sleep medications may still be appropriate, but the key is making sure they are used carefully and reviewed regularly with a doctor. Because when it comes to medications in older adults, the most important question is not simply whether a drug works. The real question is whether it is still necessary. Before we finish, I want to leave you with a very important thought. The medications we discussed today are not evil, and they were never created to harm people. In fact, many of them have saved countless lives around the world. When prescribed appropriately and monitored carefully, these treatments can be extremely valuable tools in modern medicine. But after more than 25 years working as a cardiologist, I have developed a strong personal belief about medications, especially for older adults. Medicine should always be reviewed, questioned, and adjusted over time. Our bodies change as we age. What was necessary 10 years ago may not always be necessary today. And when several medications are combined, even well-intended treatments can sometimes place additional strain on the body if they are not periodically reassessed. That is why I encourage every patient to become an active participant in their own healthcare. Ask questions. Understand what each medication is meant to do. And make sure your treatment plan is reviewed regularly with your doctor. I also want to include an important clarification regarding the story I shared earlier about Robert Thompson. The purpose of that story is not to claim that medications alone caused his passing, and it should not be interpreted as medical proof of any specific drug interaction. Every patient's situation is different, and medical outcomes are influenced by many factors, including underlying conditions, genetics, and overall health. Robert's story simply represents a real-world example that highlights a growing issue doctors see today, which is the complexity that can arise when multiple medications are taken for long periods of time. If there is one message I hope you remember from this video, it is this: do not be afraid of medications when they are truly needed, but never stop being curious about the treatments you are using. The best healthcare decisions are made when patients and doctors work together with open communication and regular review. If this video helped you think differently about your health, consider sharing it with someone you care about. It might encourage an important conversation that could make a meaningful difference in the years ahead. Take care of yourself, stay informed, and remember that understanding your health is one of the most powerful tools you have.